not many men are willing to say, hey, I have burning testicle pain.
Hello, everyone, and welcome to Vital Steps to Wellness, your podcast where we talk about everyday solutions to everyday problems. My name is Heidi Honrado with my co-host Marcia Torres. We are here. We're excited to bring special guests in every single episode. And today we have the honor to introduce to you Dr. Racquel Kurzweg, DPT. Marcia, please do the honors.
I will definitely do the honors. Dr. Racquel is a pelvic floor physical therapist and the founder of Adore Your Core Physical Therapy, PLLC, where she specializes in helping patients overcome pelvic health challenges with personalized one-on-one care. Her journey into pelvic health began during her doctoral training, where she discovered a passion for supporting women through life transitions like motherhood and menopause, inspired by a feminist perspective. Racquel initially focused on addressing the gaps in care for women, recognizing the profound impact pelvic health has on overall well-being. As her career progressed, Racquel noticed another critical gap: the lack of resources and support available to men. She realized that men struggling with pelvic pain, incontinence, or post-surgical challenges often face even greater barriers to care, compounded by a stigma and limited awareness. This revelation expanded her mission, driving her to advocate for better care and education for everyone, regardless of gender. Through her practice, Racquel combines evidence-based treatments with a compassionate approach, empowering her patients to understand their conditions and take control of their recovery. Beyond the clinic, she is a passionate educator who has taught advanced courses to healthcare professionals, shared her expertise with birth workers, and spoken to diverse audiences about pelvic health. Whether it is teaching physical therapists about chronic pelvic pain or demystifying male pelvic health at public events, Racquel is committed to break stigmas and fostering open conversations. Racquel believes that pelvic health should never be a taboo topic. Her work, whether with individual patients or through community outreach, is dedicated to ensuring that everyone has access to the care, education, and support they need to live pain-free, confident lives. Welcome, Dr. Racquel, and it's a great pleasure to have you here talking about these topics.
Thank you so much. I'm really excited to be here tonight.
Welcome, doctor. And I have the first question for you. And this is just something I really want to know. So you've expanded your services to provide the health to the male, towards the male pelvic health. So what are some of the challenges that you have faced and how you address them? And this question is particularly important to me because I learned about you and the work that you're doing. I never knew that male pelvic was a thing. Like it was, male pelvic health was a thing. So can you please enlighten us and share what that looks like?
Absolutely. And I think that to your point, I don't think many people, including men, know that it's a thing. And so I think we've become so much better with female pelvic health from a knowledge standpoint. Social media is really doing a great job of helping moms and menopausal women out there know that they don't have to deal with the leaks, they don't have to deal with pain with intercourse. But then you really saw this other gap, and that gap was male pelvic health. And now I'm a feminist for sure, but I will tell you, if you think women's health is poorly done, men's health is terrible.
Wow.
In that they don't know it exists, they don't want to go even if they do, and then even when they go for help, there's like one standard diagnosis out there. You think women have OBGYNs, men have urologists.
Wow.
That's it.
Yes.
So urologists are supposed to know both the bladder and then also male pelvic health, which they don't seem to very often. So I think men will have a condition where they start to have pain in particular, or potentially leaking, or ED. I mean, when we think of the pelvis, there are three functions. There's the bladder, the sexual function, and the bowels for all adults. And the muscles of these pelvic floors control all three of those systems. So anyone could have something wrong with any of them, and that that could be pelvic floor. And so here men are thinking there's just something wrong with me, or I'm just getting older. But I think it really comes with that lack of awareness from a pain standpoint. Not many men are willing to say, hey, I have burning testicle pain. And if they do, and they go to the doctor and the doctor says, oh, it's probably prostatitis, we'll give you an antibiotic. Okay, doc, nothing happened. Oh, well, then it's probably chronic non-bacterial prostatitis, and there's nothing we can do for you. And they're just kind of left out on there. And so I'm getting these men who are finding me from Reddit sites and from searching on their own. I would say 8 out of 10 men that I see find me on their own, not from a doctor being able to tell them, hey, I think this could be something to be helped. And I actually have a story of someone. Now, of course, this is their recollection and their understanding of what happened. I can't say for sure what happened because I wasn't there, but their girlfriend, they were struggling with a lot of pelvic pain. Their girlfriend said, I've been reading about this thing. I think you might have pelvic pain. So they'd already gone to urology. Urology had already told them, no, we can't find anything. We're sorry, but we can't find anything wrong. And so they talked to their primary care and said, well, what about this idea of pelvic floor? And the way that the doctor spoke to him, at least how the patient heard it, was, what are you, a woman? You don't have a pelvic floor.
Oh, wow. Well, that's a challenge right there. Wow.
Yeah. And they do. So men do have pelvic floors. Male and female pelvic floors are the same with the exception of one muscle. We each have a muscle that the other one doesn't have. So just to give you a sense of, like, we all have mostly the same muscles. So certainly they do have a pelvic floor, and it can absolutely cause dysfunction in their life.
Wow. Wow. Thank you for sharing that. I mean, and the first challenge that I heard was, let alone, men we know they don't go to the doctor. Like, that's just one thing, like, just general, you have some that, yes, but that's just not something they do. But to now share something that is it a thing? Is it not? It will take a lot for them to even say that. And then this gentleman that did say, and now the doctor's, well, what are you talking about? That is huge. So it sounds like there's so much work to do in this area.
Yeah, it really is. Yep. And so, as far as, how do we do that? How do we overcome some of these challenges? The fact that, you're right, men just in general don't go to the doctor. They certainly don't like going to the doctor talking about their private parts. And then when they do, they kind of are brushed aside, like, well, we don't really know what to do. On the rare chance that they might say it, or they find it in Reddit, hey, there's this thing called pelvic floor therapy. You should try it. Well, trying to find a pelvic floor therapist, one, is very difficult. We are a small group, but on top of that, when pelvic floor therapists are trained, in general, they're trained for women to start. That's their foundation. And then they have to go on and take even more coursework to see men. And so even as someone goes calling around to see if they can get in with someone, they're finding at least half the people they call don't see men. Oh, no, I'm sorry. We don't treat that. We don't treat your kind, And so that's even more of a challenge. And you can imagine it can be very discouraging for them. And they can just sometimes they give up for a while because it's very difficult until the condition's so bad that they just can't take it, or they start to see that awareness. So maybe they are going down that Reddit line, or they're seeing on social media a little bit about, this might be a thing. Maybe there is hope for me. And so I think that is one of the big things about overcoming it, is that how do we get that awareness out there? How do we let men know you do in fact have a pelvic floor, you have a pelvis, and it's okay if something's going wrong. There's actually things we can do about it. It doesn't have to be scary or intimate thing. It can be simply, listen, there are muscles and we need to work on those. It's just like if you had an ankle sprain, just in a different place.
Yes.
Yep.
They need to be taken care of, basically.
They do.
Yeah.
Like any other muscle in the body. And that's exactly what we need to approach it as.
Everyone wants healthy everything. So let's just add that to the list. And I think when they hear that, a big big thing that I try to do is education. When I can pull out a model and show them, look, it's no big deal. They make like, these are the muscles here. Oh, is your pain here? Let me show. Is it right here? Yes. How did you know that? Because there's a muscle right here called the superficial transverse perineal muscle, and it's the most common muscle that is going to be painful. Or there's a muscle here that's supposed to squeeze out the very last of the urine when you finish going to the bathroom, and yours is just weak. We just have to train you how to use this muscle again. That's it. There's nothing wrong with you. You just have a muscle that needs to be worked on a little bit. And I think that education for them is empowering. They suddenly feel like, oh, I'm just a human being and this is not that big a deal, and I should have taken care of this a while ago.
Yeah, that's right.
Yeah, it brings me to think about a few things here while I'm listening. Number one is the awareness, the education, and that has to start from younger ages, right? Making them aware that we are full of muscles and muscles are everywhere. And then if something hurts in that area, that's also another muscle that needs to be taken care of. But when it comes now to an stage of an adult, right, is I think just opening or just talking more about that the possibility that there is such a thing as pelvic floor and there is a need to be taken care of. And that brings me to the other need, which is having more medical care for this need.
Yeah, we definitely need more people we need more medical providers to know that this is out there, and we need more of us as providers to be out there and a little bit more open and easy to find. Yeah, so that's something, a challenge that we're always facing, but something that I am personally trying to do a little bit more with. I'm actually trying to create a collective, at least within our area in Western New York, of pelvic floor therapists, and get a better, like a directory that anyone can go to and say, hey, what do I need? Oh, there's actually 30 different therapists in Western New York. Okay, let me just see which ones see men. Okay, all right, now I've got it down to 10 or 15. It makes it much more accessible. So that's a goal and a project that I've got going on for 2025 is trying to make, at least here in Western New York, a little bit more accessible or easy to understand and easy to navigate this field of pelvic floor therapy.
And it is something that always amazes me about you, Dr. Racquel, that you are always trying to be proactive and just see more like, how can I help the community? And that brings me to my next question. The question I want to ask is, how can we as a community break the stigma around pelvic health and encourage more open conversations about this vital topic?
Yeah, and so I can think of a lot of ways, but something you just said about like even the young people, like that is the more we can be open with our young people. If you have children, if you have nieces, nephews, just talking more about, instead of having this place in our body be just the private place that we don't discuss and nobody says anything about, no, this is where we pee and poo, and we need to be doing those on a regular basis. And when you get older, there'll be a sexual component to it, and it being more of just like, this is another part of your body. It's no big deal. So normalizing the conversation, starting as young as possible to really normalize that conversation, right? Of here it is, normalize that there's problems out there. So when people come into me, they feel like they're alone. So as soon as I can say to them, let me guess, this is what the doctor told you, and they say to me, how do you, I'll never forget, I said, I'm like, wait, let me guess. The doctor said, oh, you have you have prostatitis, you took 2 rounds of different antibiotics, they didn't work, and he said, oh, it must be chronic non-bacterial. And he just looked at me dumbfounded. He's like, how do you know that? So because that's what they always do. I see these all the time.
So you see the aha moment, how their face is
that
like,
aha
yes.
of, wait, I'm not the only person that has this. This isn't the only thing. People think because it's not something you talk about at the water cooler, they do think that they're very much alone and that they're the only one, and it's the strangest thing. And I really take the time to highlight that there's something to be done about it. They're not alone in this. There are lots of people with these conditions. 1 in 3 women have incontinence, over their lifetime. 1 in 4 women right now have pelvic floor dysfunction. I can quote you women's stats because they're done. I can't quote you men's health because they're not done. I think there is some there's some assumptions, like they've never truly done a really good study on it, but it's something between 1 in 9 to 17 men are, I believe, is what they say as far as pelvic floor dysfunction for men. You know, it's out there, and the more we can normalize the conversation, highlight that you're not alone, and then educate. So just bringing this up as normal conversation and saying, hey, I hear what you're saying, but it's not normal to pee your pants. So maybe we should talk about that. You know, too many, now this comes more broadly. I would say men are very aware that they should not leak urine, and they're very embarrassed by it if and when that happens. But women start to just think it is normal. Oh, I'm just getting older. I'm 30 now. I leak a little when I cough and sneeze.
Yeah.
And yes, it's common, but we never want to think of it as normal. So I think that helps. I do appreciate that there is a little bit of a breaking of the stigma by normalizing with different commercials, and even people just saying, oh, you know, just laughing it off. I think that has normalized it a little bit and broke the stigma. But now we have to take that to the next level of not living with it and realizing that there's something to be done about it. So then this education, even offering supportive spaces, you know, this is something, whether it be virtually or in person, is there a supportive place that we could to give these people? So whether that be men with chronic pelvic pain, women with endometriosis, what is it that we have that we could provide a support to? And I've seen that be helpful and kind of bring people together and break that stigma too, of just having those support groups too.
Yeah, I agree. And you know, and women, we're quick to say, look for that support group and say, okay, yes, I'm gonna go and talk to my girls and my sisters, you know, but men don't do that, right? So I think that it's so important to create that safe space for them to say, hey, you know, so they continue to have those aha moments, you know, like that you see in, you know, when you meet with your patients. And the other thing I wanted to mention, going back to that education piece that, you know, Marcia mentioned, you know, starting as early as possible. And it got me thinking of when, you know, we're in school, and I think it was around 7th grade that I remember my kids were like, oh no, I don't want to know anything because we're going to start having these, you know, these classes. Why not have those conversations there? And, you know, and I have a boy and a girl, and I remember trying to get more prepared. Okay, I have to talk to my daughter about her period or this or that and how she's going to feel. But we never had that type of worry or concern with my son. It was more of, oh, they have to know about the things that happen when you grow up, and, you know, that intimacy and all that, and, you know, what happens if you don't do the right thing. But it was never that of that health. So even just at home, just changing the mindset and being okay talking about it in the school, so that this is part of, include that in the health, in the health education class that they talk about, you know. And I think
it's interesting, and I just sort of thought of this when you said that. We make it with girls, we educate them on their period, and we help them through that transition, and we know when things are wrong, and we talk to them about if we think it's wrong or right. When do we ever talk to a man or a young adolescent male about what is normal, what isn't normal? We just, I mean, we just assume that everything, oh, you're a man, you have a penis, everything will be fine.
Yes. And just make sure you don't do the wrong thing, and, you know,
yes, that you don't impregnate someone. That's not, well, talk to me if there's pain, talk to me if there's a weird curvature to your penis. Yes. If you feel, if you're not getting, so at night men should have nocturnal erections. Talk to me if they're not happening. There's a newer diagnosis coming out called hard flaccid syndrome, where there is this inability to truly get a full erection, but they also never feel as if it ever goes completely flaccid either. So it always feels partially hard, sort of rubbery, very uncomfortable, but they also can't get a full erection. Nobody's talking about those, right? We're just, you know, like I said, I just realized that we just assume every boy will have normal, perfectly fine pelvic floor erections.
Yep. And they never feel pain.
Yes. And they never feel pain. They never feel pain.
No. Yeah, but and again, you would never say anything. You would be some sort of an outcast if you did. It would be you and only you, because nobody has ever mentioned that ever. And
So going back to thinking of the awareness, where should the awareness start? You know, with the children as early as possible. What about the parents? Or, you know, so there's so much there, and I'm glad that there is someone, there's people like you and professionals like yourself that they understand that there's this need, and it needs to grow, and I'm glad that you're taking this initiative to bring this, even it's starting here in Western New York, and I know that it'll grow because there is a need.
So when I think about the schools, right, how can we start revolutionizing the idea of just having those conversations with their parents? Because it has to start at home. We can't expect that the teachers will teach them everything at school. With having conversations at school with their parents, or where that starts, like that's a question that comes to my mind when we want to create that awareness. Because now we know that there is also homeschooling. So there are people that go to school. Right. So we're start creating that awareness.
Yeah. And I think that's a really great place for us to work into too, of how could we reach those parents? Because I also agree that I think that is traipsing into some very personal space that maybe parents don't necessarily want their children exposed to. So starting with parents is probably, and allowing the parents to either consent to that and have some sort of education for the children then, or just educating the parents and letting them know, listen, this is an important conversation. Social media, I think, is so great. I think most people who are parents now have most of the time had social media. So I feel like that's still a great place. But I also feel like there needs to be some outreach, and I don't know what that looks like, but I think that I think certainly that needs to happen, is some outreach to parents. Maybe, does that mean workshops for teaching, helping the parent to give the birds and the bees conversation, the real birds and bees conversation, having a workshop, even because I would imagine, I'm not personally a parent, but that idea terrifies me, to try to, I do see pediatrics. So trying to explain anything to a child in a way that's appropriate, but also accessible is extremely hard. So maybe something like that. Is that something we need to try to have as some type of a workshop, starting to have a training for parents to be able to understand what's going on, and then having that teaching starting a lot earlier, because that is another group, is pediatric. So many young kids are constipated, and we have so many parents dealing with that as well. So, it's like helping them to know the pelvic floor for their children through the lifespan.
Wow. I agree with you. I mean, I have now a 19-year-old and a 14-year-old, but I wish that I had someone to say, listen, this is how you speak, because, but to include everything that they need to know. And I think that's a great idea. Just, having those workshops and really starting with the parents and educating them, because with that, like Marcia said, it starts at the home.
And like you said, it's the health. But it's the health component to it, not just the here's the birds and the bees, but know what's normal. Do you, hey, I've been watching you poop and pee over the last 15, 12 years, but know that this is kind of what's normal. Here's what you should be watching out here for. Here's what's going to be happening now as you start to mature sexually, and here's the things to watch out for. But these are the healthy things. These are the unhealthy things. Let me know if any of the unhealthy happen.
Yes. And that can be a much easier conversation for some parents, to say it, just focusing on the health piece versus just the other piece, because that's always difficult. But
that's that can be uncomfortable with your children, I'm sure.
And I think that the approach that you gave at the beginning of this conversation, I think is such a beautiful way to put it, right? Starting with the point of we are made of muscles, and muscles help us to stay still or strong, just to do so many things in our body. And one of the functions is with the pelvis. So just starting with a simple analogy, it breaks, it kind of dismantles the taboo that get to say, instead of saying, let me talk to you about the pelvis. That will be scary, right? But let me talk to you about your muscles. What a different way to start session.
And how amazing muscles are, and how we want to keep our muscles healthy. And here's all the different things that healthy muscles do. And doesn't that make you want to do it? Because when you're thinking of all the good, when we see that positive side, when we think, I want that health, I want those big strong muscles, or the really flexible muscles, whatever their goal is, that's so much more desirable than being behind the 8 ball saying, I want to fix this, I want to change this. That goal of health, that enjoyable goal of health, I think think is such a nice way to look at it too, getting ahead of the issues.
Yeah,
Definitely.
definitely a nice angle to approach something that it has been a taboo and a topic of no conversation in the water cooler for sure.
Yes.
Yeah.
Oh my goodness. Dr. Racquel, can you just share a little bit about the way you started your practice? I thought it was so unique and so inspiring.
The practice itself or getting into pelvic PT?
I would be the practice, how you started
Yeah.
Adore Your Core.
So I worked for a hospital-based system to start, and I started their pelvic floor therapy program, and I worked there for a number of years. And then unfortunately, we do live in this capitalist society, and even without it, we were working for a business, and that business needed to make enough money to stay running, and they run off of insurance reimbursements, and they kind of came to me and my coworker and said, you need to be seeing a lot more people. You need to see X number of people. And I looked at it and I did the math, and I said, that's almost doubling my caseload. How in the world am I going to see twice as many people? I'm not going to be able to give good care. And I said, well, I can't do it. It was cut my treatment time in half, but I won't give good care, or try something else. And so I said, you know what? I'm going to try it. I'm going to say, I'm going to put care first. I'm going to start my own place. So I thought about it, and I thought about it. And I remember passing by of all the silly things, I was passing by this chair, and I thought that would be the perfect chair for my office. And I thought, okay, the universe is talking to me. That's it. And so I started that path, and I never looked back. And it was actually funny. I worked briefly in home care while I got the business going. I thought, oh, it'll be a small thing. I'll just do it on the side in the evenings, maybe the weekends, and I'll do this home care during my day. And it was not my passion. It was not my thing. I came home to my husband and I said, I think I'm going to quit my job. And he said, I don't think that's a good idea. Just started this business. Well, I'm going to try. And I just threw all of my energy into it. And I said, if I just throw all of my energy and my passion into this business, Adore Your Core PT, I'll see what happens. And if I have 6 months down the road, if I have to go back out and get a different job, then I will. But I think that it resonated with people. And I think it does with my patients, that I try really hard. Their care is very, very important to me. The space that they're in is very important to me. I think of it from all the aspects. When I worked for the healthcare system, you had to, and this is what we had, and it was just fine, but you would walk into a busy physical therapy gym, and then you'd walk through that busy gym into the weird room in the back, and like people are in the gym are like, what goes on behind that door? Oh, you don't want to be in that room. It's kind of awkward, right? So now, when you come into my space, there's literally nothing else going on. Anyone who's coming in there is coming in there for that. It's very calm. It's very serene. Everything's soft. Everything's caring. Everything's put in there with love. And I think that speaks to people, and they just begin to calm and relax and know that they're in a good space.
Wow. Thank you. Oh my gosh. I've never heard your story. Marcia, thank you for having her share that, because and Marcia told me, wait till you just hear her story. Wait till you learn more about her. And thank you for sharing that, and it is unfortunate what's happening, with healthcare and all that, but it's just, but as health coaches, Marcia and myself, we understand the need for the care and the time that we need to have, no matter where it is. We need to be with the patients, with the clients, to make sure that they get what they need. And for you to say, I love what I do. I know the value that I bring and the lives that I can change, because I have that power to do that. And you said, I'm going to put care first. That is powerful. So thank you for doing that. And now, obviously it's a work that it's needed. You're a trailblazer. I see you as a trailblazer.
Well, I'll say I see both of you as trailblazers too. I was just listening to I was taking a course on a certificate program for endometriosis. And in it, she's got a doctorate in nutrition. She's got a doctorate in physical therapy. But she said, in these coming years, AI is going to diagnose everyone. And all they're going to do is the computer's going to spit out, here, you need to diet, exercise, lower your stress. It is isn't the prescription we need. It's the people coaching us through it. If it was easy, we'd all have it done. We all, for the most part, know what we should do, but it's going to be the health coaches and the therapists of the world that are helping to make the changes for people, because telling you what's wrong isn't nearly as hard as making the changes that it takes to see you to the other side where that is actually changed. So, I think both of you are doing a phenomenal thing by being health coaches too. I think that is really where we need more people, and I think people don't value it as much as they should yet. But they will. I think it will become such an important part of our healthcare system soon, because there simply is not going to be our diagnosing is going to be so good from AI. They're going to be able to say, yes, this is what's wrong, X, Y, Z, and here is the list of things you need to do. And you're going to be looking at this list of 15 things thinking, how am I ever going to make all these changes? And then that's where we're going to set you up with a health coach who's going to help break that down for you and take you through to where you need to be.
Thank you for saying that, doctor. Thank you so much.
Thank you so much, doctor. And you really always inspire me. And I can say to everybody that's listening that, what she said about her office is a beautiful space where you do feel invited. You feel like you are there and they're with you like nobody else. So you feel important and you feel care. And that just right there lowers your blood pressure, right? The healing starts right there and the way with your clients. And I truly appreciate you to be here. And you know what happens when we're having so much fun? Time flies and we have to finish this podcast. But I would like for you, Dr. Racquel, to give us your last words. And also for everybody, just let us know where they can find you. Either social media or your office, just let us know so they can hear and they can have the honor to visit you and to get some care from you.
Well, I think the final thing is something I say to people a lot is don't ever stop searching for the help to whatever your problem is, to your pain or your condition. Someone out there is going to be the right fit for you, and when you find them, it's going to get better. So just keep searching for your happiness and for your health, because it's out there somewhere. And if that can be me in any way, I'm certainly would love to help. Probably the best way to reach is through social media. I'm on Facebook and Instagram, Adore Your Core PT.
Thank you, Dr. Racquel.
Thank you
so much. Thank you for your time. We really appreciate all the wisdom that you have provided today to everyone. And definitely we're going to start a campaign of awareness about pelvic.
Yes.
Really,
I'm growing my group. Crusaders out there.
Yes.
Thank you, ladies, so much for having me on too.
Thank you.
Thank you for being.
And we really appreciate all our audience for being here today. And we're looking forward to see you on the next episode with another special guest. Thank you so much for all your time, and thank you for having us in your home or wherever you are. Thank you.
Thank you. Bye-bye.
Bye-bye.